Raquel Archie. I'm an anthropology major and I also have a minor in ecology.
So you're one of the students that received the Woolner Scholarship this year. Can you tell me a little bit about your project and research that you're doing?
Yeah. We're researching unknown routes of zoonotic disease transmission at the Toronto Zoo. We're using scan sampling techniques to observe lemurs in their enclosures, as well as participant observation for zookeepers, and we're just trying to figure out if there are any routes of transmission that have gone unnoticed by the zoo, and hopefully we can make some changes if needed.
Do you go there in person?
Yes, yeah. So we've gone twice so far. We still have a lot of more data collection to do. We're just waiting on some approvals for the actual human stuff, so like the interviewing zookeepers and following them around. We haven't done that yet, but I'm very excited to start that.
Elaborate on the importance of One Health in your research.
Yeah. So zoos are institutions where humans and animals are living and working together very closely, and this can increase health risks for both populations. So it's really important to view the human, animal, and environmental health as one to help mediate these risks. Understanding the interactions between the focal species, which in our case is lemurs, and the human aspect, which is the zookeepers, and the other wildlife that can go in and out of the enclosures. It's really important to understand those interactions and try to help uncover those zoonotic disease transmission routes, because zoonotic diseases can be really detrimental. So ensuring the health of humans can also ensure the health of the animals and the environment as well.
So I think you kind of covered this, but like how are you implementing One Health in your research?
So current literature states that 65 to 70% of emerging infectious diseases are zoonotic, and zoonotic diseases are spread between animals and humans. So incorporating One Health into this research is really beneficial because we're looking at the health of animals and humans and the environment as one.
Is this the first time that you were introduced to One Health, or did you take a course that introduced you to One Health?
Yeah, so the professor that I'm working with this summer, I actually had a course with him, and that's where I learned about what One Health was. He does a lot of work in Madagascar, and he incorporated that into our lesson plan. So then when I applied for this job, I was really excited because I already knew about One Health, and I think that it's really important that we're incorporating it more into the disciplines.
Okay, do you want to mention just really quickly the prof's name?
Oh, yes.
And what course you took from him?
Yeah, the professor is Dr. Travis Steffens, and it was public anthropology.
Working closely with Dr. Steffens, has that like opened up anything specifically? Like I know you already took a course with him. Working one-on-one with him, has that sparked anything?
When I had taken that course with him, he explained, obviously he introduced himself to the class, and I always found his research interesting because he's a biological anthropologist, and I have always been like, with my ecology minor, I've always been interested in the biological aspect of anthropology. So when I applied for the job, I was really excited that I got it because I wanted to work with him anyways. But then working with him, seeing how he is like as a professor, as a boss, it's really great, and I feel like moving forward, if I ever needed anything from him, I have like a very good connection there.
Okay, perfect.
Yeah.
Is there anything that stands out to you from your research that you were able to learn from, whether it's One Health or just big idea type of thing?
Yeah. With this studentship, I'm able to do a lot of stuff with the One Health Institute. So I did like the Exploring One Health program and stuff like that, and I found it really interesting that I was able to reflect more on the fact that a lot of people actually don't know what One Health is, and I think it's really important that we continue to talk about One Health and input it into other places. I even, when telling people about my job this summer, explaining One Health to them, everyone finds it very interesting, and I think it would be really important to make sure that that gets broadcasted more.
Have you had any opportunities that are similar to this before?
No, I haven't. That's why I'm really grateful for this program, but I'm also really excited. I'm hoping to pursue a master's, and I would really like to pursue the One Health specialization. So I'm really grateful for this opportunity to learn more about One Health.
Did you learn anything specifically, like a fun fact about lemurs that you want to share?
Yeah, there's actually so many. So my favorite is that lemurs, they move in like a matriarchy, so the women are in power, which I'm really into. Do something called sunning, and I think this is common in like most primates, where they like open their body up and let the sun hit them, just so they warm their body, and it's really cute.
Okay.
Yeah.
Okay, perfect. Okay, I think that's
Awesome.
all of it.
Oh yeah. I've been eating these little pineapple pieces.